Good evening, everyone. How are we all doing today? Hi, I'm here today for with Rowaida Sadat. She is from Ankara University, Turkey. She's from Afghanistan. She's a 2023 International Maternal Newborn and Health Fellow. She is an amazing personality on our webinar today, the Protect Mom and Child Forum. And then we're going to be having a discussion on immunization. We're going to be using Afghanistan as a case study, how Afghanistan is working towards, getting to the agenda 2030 to ensure that everyone, everywhere, at every age fully benefits from vaccines for good health and well-being. As we all know that immunization is an essential part for every newborn and every child. Welcome today, Rowaida. How are you doing?
Thank you so much. Good evening, Yatinda, and thank you so much for having me on this insightful webinar on Survive and Thrive Immunization as a key determinant in newborn health. And I'm so honored to be your guest speaker today. So I hope we will have a pretty interesting webinar with you today.
Yes, thank you so much, Rowaida. I'm very, very excited to have you on today's webinar. It's amazing. Thank you for, honoring my invite to be our guest speaker for today's webinar on the Protect Mom and Child Forum. So diving into what we have to discuss today on immunization, I'm going to be asking you one very important question that is, very vital to every newborn and every child's well-being. We all know that immunization plays an important role in protecting children against preventable mortality over the years. What do you think are the different types of immunization that we have, and what age do we administer these different types of immunization to children?
Thank you for raising an important point about the pivotal role of immunization in protecting children against preventable mortalities, because immunization has indeed made significant strides in reducing the burden of infectious diseases and ensuring the well-being of our children. So looking at the different type of vaccines that are routinely administered to the children, each of them has a specific target. Because when you are speaking of vaccines contain the harmless component of the pathogens. So it gives your body to understand and recognize the foreign substances that enter your body, so it can give you a better response and reaction towards it. So first, we have inactivated vaccines. Inactivated vaccines, they contain the killed or inactivated version of the pathogen or disease-causing agents. For example, we have influenza, we have hepatitis A, and usually they start with different multiple doses starting at age of 2 months. So according to the different type of inactivated vaccines, we have different dosage and different time and schedule for that. For example, for polio vaccine or IPV, usually 4 doses are recommended at age 2 months, then 4 months, and then 6 to 18 months, and so on. Secondly, we have live attenuated vaccines. So they contain the weakened form of the pathogens that we have. For example, we have rubella, varicella, or the chickenpox, and they usually administer at starting at age of 12 to 15 months. So again, as I said, there are different dosages for each type of that vaccines. And third, we have the recombinant or conjugate vaccines, and they use specific parts of the pathogens, like the proteins or the polysaccharides, so they stimulate an immune response. And again, they have different types. For example, for PCV, the number of doses depends on the vaccine brand. So common schedule include doses at 2, 4, 6, and 12 to 15 months. And lastly, we have the combination vaccines. So the combination vaccines, they combine multiple type of vaccines into single shot. So it reduces the number of injections that we require, and vaccines like IPV, HIV combinations, or MMRV combinations, they provide protections against multiple diseases simultaneously. And as I said, it is important to note that vaccination schedule may vary slightly across the regions and countries. So healthcare providers follow the guidelines that are set by the national immunization programs. And as I said, for the newborns and infants, there are again different type of vaccines. We have hepatitis B, we have polio vaccine, we have PCV vaccines, and they vary according to the infant's status and regionally, of course.
Thank you, thank you, thank you, thank you, thank you so much, Sadat. Because currently we still have so many mothers and even so many parents that do not understand the different kinds of vaccines they're expected to get for their children, even from newborn. As you've mentioned, the healthcare workers are very, very crucial. They are very, very important to be able to ensure that even as they have this schedule, they also show it to mothers, show it to fathers, to let them also know when and what kinds of vaccine they should get for their newborns and the time schedule when they should get these vaccines for their children. So moving on to the next question I want us to discuss right now, say that is that currently, what do you think is the immunization coverage globally? Then I also want you to dive deeper and take Afghanistan, your country, as a case study. What do you think, what is the immunization coverage right now globally, and then diving deep into Afghanistan?
So currently, global immunization coverage has made significant progress because there has been so many programs working towards it, but there are still challenges in achieving high coverage rates across all regions. But as WHO and the United Nations Children's Fund UNICEF regularly monitor immunization coverage worldwide, the data shows that we have approximately 86% of the children receiving the recommended 3 doses of the DTP vaccine. However, these coverages are actually showing variations between different regions and for specific vaccines. But unfortunately, in case of my country, Afghanistan, we still have some struggles to achieve the high coverage for immunization. And not just Afghanistan, countries like Pakistan, Nigeria, Somalia, South Sudan, they are also countries with lower coverage. Especially for DTP vaccines. But in my country, especially polio vaccine is one of the specific goals that we want to achieve because, polio is a disease that actually affects the children widely across the countries, and in lower income countries like Afghanistan and Pakistan and Nigeria, they again face many difficulties to achieve high polio vaccines. And Afghanistan is among the, I think it's the second country having, again, the several polio cases yearly. But for different vaccines, we have about 61% coverage rate in Afghanistan, but it varies greatly according to what type of vaccine we are speaking. But now the polio vaccine is like our main target in Afghanistan. And WHO, UNICEF, they're all working with the communities in Afghanistan to achieve a higher coverage rate with the vaccines.
Thank you so much, Rowaida. So I'm just kind of looking at it. For example, in my country, Nigeria, we have made significant progress. I cannot lie to you. There have been health system strengthening in such a way that they are building capacity of health workers in such a way that during immunization periods, they take this immunization even far to the rural communities to ensure that every child gets vaccinated. So for Nigeria, we are really, really trying, and we are making significant progress. However, we still have some factors, mitigating and drawing us back. We have factors like the social norms, we have factors like cultural issues, we have factors like vaccine hesitancy. I just want us to just dive deep and talk a little bit about some factors that could prevent us as the maternal and newborn health community, from achieving the global immunization strategy by 2030.
So there are different factors that actually contribute to the high rate of vaccine coverage in countries. But like if you look at Afghanistan as a case study, we have specific challenges that contribute to poor immunization coverage. The first one is conflict and instability, because Afghanistan has been grappling with ongoing conflicts and political instability for many years. I have been in Afghanistan for 18 years of my age, and my mom is also a doctor, so I have been in the healthcare system and I have experienced the poor infrastructures myself. So the situation has severely impacted the health system and hindered immunization efforts. So according to UNICEF, an estimated 3.7 million children in Afghanistan are unvaccinated or under-vaccinated because of the conflict and insecurity in Afghanistan. Secondly, we have geographical barriers, because Afghanistan rugged terrain and remote communities present significant challenges in reaching population with immunization services, because approximately 20% of our people, they live in hard-to-reach areas, So it is kind of difficult for the healthcare providers to go to there and, work for the vaccination. Thirdly, we have limited healthcare infrastructures, because my country faces challenges related to healthcare systems, including shortage of healthcare facilities, particularly in rural and conflict-affected areas. So according to World Bank, Afghanistan has only 2.2 hospital per beds per 10,000 people. And well, this is below the global coverage. And this actually affects the delivery of vaccines and healthcare services to the urban areas. 4 is the vaccine hesitancy and cultural factors, because vaccine hesitancy, not just in Afghanistan, in many other countries, it contributed to poor immunization coverage. In some communities, misconceptions, the mistrust surrounding the vaccines, the cultural barriers, the acceptance and uptake of the vaccines, they all actually contribute to the poor immunization. And of course, education. As you already know, now education is banned for females in Afghanistan. No university, no school. And as you know, maternal health and neonatal health are so always with each other. So if you have a healthy and educated mother, you will have a healthy and better infant. But when the mothers are not educated enough about their pregnancy, how they should treat their children, what is vaccine, why it is important, of course, it contributes to the lower immunization coverage in countries like Afghanistan. So if we want to make the efforts, we should actually look at the socioeconomic structure of the country, and not just work with health providers, but also work with the community, with the religious leaders, with the political leaders, with the families, with different communities, and actually understand how to communicate with them, and giving them the insight that, vaccine is something which is scientifically based, which doesn't have so many side effects. We will, examine your child and then prescribe the vaccines according to that, because communication and education is one of the biggest factors in reaching the global coverage in countries like Afghanistan.
Thank you so much, Rowaida, for diving deep into all of these factors. I'm just kind of, very, very, I'm just thinking, what do you think we can do to, solutions, sustainable solutions to ensure that routine immunization gets to children at any place they might be, particularly using Afghanistan as our case study today? What can we do as healthcare workers, nationally, globally, regionally? What can we do? Sustainable solutions that we can provide to the maternal and newborn health community that can help us achieve this global immunization agenda before 2030.
So to ensure routine vaccination for children, both globally, nationally, and regionally, countries have implemented several strategies and plans in collaboration with international organizations, the government itself, and healthcare providers. So first one, we have like the national immunization programs. So many countries have established their own national immunization programs that serves to actually achieve that high coverage rate. And this program develop comprehensive immunization schedules, the guidelines, the policies that are tailored to the specific need of each country. Then we have expanded program on immunization, which we call it EPI. So the EPI is led by WHO and UNICEF, and it supports countries in reinforcing their immunization systems. And then we have, of course, monitoring the vaccination coverage, because, you have to see, the records, the data, and regular monitoring of vaccination coverage is so essential to identify the gaps and to track the progress. And then we have, in many countries which are below the poverty line, like Afghanistan, financing and support is so crucial, because conflicts can be always in a country, like in my case, like Afghanistan, but we should ensure that healthcare systems and healthcare infrastructures are not affected that much, because politics is completely a different topic, and science and ensuring that people have the right to be healthy, to have a better life is a completely different issue. So financing and supporting healthcare facilities and vaccination in fragile settings is also so important. And of course, community engagement, because community engagement is so vital to address vaccine hesitancy, increasing the awareness and building the trust in immunization. There are several countries that develop strategies for community outreach, the education, mobilization to ensure that parents and caregivers understand the benefit of vaccines and the importance of timely immunization. So we can have so many campaigns, we can involve the community leaders, we can leverage healthcare workers, ask for advocation for vaccination. And of course, we have collaboration, because regional collaboration and initiatives facilitate the knowledge sharing, resource mobilization, and joint efforts to improve immunization coverage. So all of them together actually contributes to achieve the goal that we have for 2030. But the important thing is to tailor each specific strategy according to that community, because cultural norms, religious beliefs, they all actually contribute to reach what we want. So it is so important to understand the structure of the society and then take actions according to that.
Hi, Rowaida, you have, touched on so many points. One specific thing that really got my attention is the fact that we need to tailor all our strategies, all our plans, all our sustainable solutions to the particular community where we are dealing with, because different communities have their own norms, their own culture, their religious beliefs, whatever they think. It's very, very important that whatever strategy we are taking to be able to ensure that vaccination gets to every child in every corner of the world is tailored based on what the community is really, it's really about. So recently, we just had our 2023 International Maternal Newborn Health conference in Cape Town in South Africa. The next one will be happening in 2025. I am very excited because you attended the conference and I knew you took out so many solutions, so many information with you from the conference. I just want you in just 2 sentences to just give us some key takeaways that you took away from the conference, particularly relating to the Global Immunization Agenda for 2030.
So attending a conference such as IMHC 2023 Fellowship Program provided me a valuable opportunity to stay updated on the latest development and discussion in the field of healthcare, especially vaccination. So while I didn't attend the specific programs, but I can share with you some key takeaways that are commonly highlighted. The first one is the importance of vaccination, of course, because vaccination remains one of the most effective public health interventions in preventing infectious diseases. Secondly, we have vaccine safety and efficacy, because there were so many discussions around vaccine efficacy and safety, which are so crucial in addressing concerns and promoting public confidence. And of course, there were several types of immunization strategies and coverages that this included discussions on innovative methods, reaching out marginalized populations, addressing disparities, and implementing immunization programs in resource-limited settings. And of course, vaccine hesitancy and communication, because also in conference, they addressed vaccine hesitancy and effective communication strategies to address it, like presentation, workshops, campaigns, and of course, tailoring communication approaches and addressing misinformation in that specific community that you are talking about.
Thank you, Rowaida. You made it seem like people listening that will be listening to this webinar will be like, oh, I'm right there at the conference, just giving us this, background of what you took away from the conference. Thank you so much, Rowaida. I'm really, really excited to have you once again on the program. So I'm also, I want you to just give us some key call for action. First, we want us to discuss a key call for action for mothers themselves, for parents themselves, for fathers. I want to also to just boil down and also give us a call for action for community leaders, call for action for healthcare workers themselves, and even call for action for the political one can benefit in good health and well-being.
I lost your voice. Sorry. I think it's with my internet connection. I guess I got what you said.
Oh, okay. Okay, then I can just recap what I mentioned. So it's in just for us to have some call for actions. We're going to be having a call for action for the parents themselves, for the mothers themselves. What do we want to tell them? How can they also contribute to ensuring that we're able to achieve the Global Immunization Agenda by 2030? Call for action for healthcare workers. How can they contribute? How can they continue to boost how they are working now? What can they do better? And they, ensure that their efforts in ensuring the global immunization agenda is reached by 2030. Then what can we say to the global leaders? I want us to.
But I mean, I'm not sure if I get that right because of the internet connection. But for me, healthcare is a multidisciplinary field, and collaboration among healthcare professionals is so essential, as well as the collaboration between the healthcare professionals and the community. And when you're speaking about the community, as you mentioned, it can be the families themselves, it can be the religious leaders, the political leaders, everyone in the society. Because by working together, by sharing the knowledge and leveraging each other's expertise, we can provide comprehensive and integrated care to our patients. Because to foster a culture of teamwork and open communication where every healthcare professional's contribution is so valued, we need to work together and understanding the patient-centered care and understanding that, infants are our future actually as another generation. So by nurturing our well-being and by sustaining our passion for healthcare, we can actually better serve our patient, and together we can continue to strive for excellence, embrace innovations, working toward creating a healthier future for our infants and for our babies, and understanding that education, communication, and collaborations are the three important key factors in achieving the global vaccination rate by 2030, because education, not just for healthcare providers, but also for the communities, is so crucial and valuable.
Thank you so much, Rowaida. I'm very excited by the three key words you just mentioned: education, communication, and collaboration. They're very key to be able to, ensure that we're able to achieve our global immunization agenda by 2020, 2030, and even all the sustainable development goals that we have, hanged on our neck as the maternal and newborn health community. Thank you again, Rowaida. Thank you for everything we had to discuss today on this webinar today. And I hope that everyone that is able to, come across this information will be able to help us pass it around, to the stakeholders, to the community leaders, to even mothers and fathers themselves, even to stakeholders in the maternal and newborn community, even to political space. They are very, very key. We do.